Helping you feel good from the inside. Bone weakness and issues like osteoporosis are more common than you think. And now, thanks to the amazing doctors and scientists at RIA Endovascular, it's more treatable than ever. Dr. Tony Brown stopped by to share with us the huge advances in technology and how he can non-invasively treat and heal your bones.
So Tony, you are an interventional radiologist. Let's start off with an overview of what that means.
Sure. So an interventional radiologist is a minimally invasive surgeon. And the name itself is a little difficult for people to start with, but in general, surgeons are based on the organ system they treat for the most part. If you're a neurosurgeon, you treat nerves. If you're a orthopedic surgeon, you treat bones. An interventional radiologist is not bound by a single organ system. We're able to do a procedure if we can see the abnormality on imaging.
Okay.
So if you can take a CAT scan or an MRI and see a problem, very likely an interventional radiologist has a procedure for that problem. So we do procedures in almost every organ system, and we do them by a minimally invasive approach.
And I bet your patients are really benefiting a lot from your interventional radiology. What are some of the specific benefits that you're really seeing?
So one of the major benefits of a minimally invasive approach to a disease is you have way less time that you're down and out after a procedure. The recovery time is significantly reduced. Additionally, the minimally invasive approach allows us to get different places in the body without having to make large incisions.
Right.
Infection risk is decreased, hospital time is decreased, and patients tend to do great with less pain after our procedures.
And that is always good to hear. All those things, just keeping it as simple for the patient as possible. So besides just starting, going to the website, checking things out on your own, there's a really specific condition that you want to talk to us about today.
Yeah, I'm glad to be here to talk to you and your viewers about osteopenia, osteoporosis, and kind of the complications that can occur due to that. Now, just as kind of a background, the skeleton is one of the systems that we treat in interventional radiology. And when we're young, our bones are strong and we're able to do things that Coloradans do.
Right.
We ski, we bike, we jump out of airplanes and do all the crazy things that we do here. Now, our bones are able to manage the impact and the stresses that we put on it. But as we age, osteopenia can set in. And that is, as we age, our bones get less good at being able to stay strong and able to resist impacts. And so in people who are in that late 50s, early 60s age, they start to have a demineralization in their bones, whereas they don't stand up to impact as well. And if that progresses to osteoporosis, what ends up happening is those people may end up fracturing due to a force that would never have caused a fracture in a younger person.
Okay.
So this complication of osteoporosis, which is a pathologic, a disease type thinning of the bones, results in people having a fracture related to slipping on the ice, for example. Or sometimes even in the worst case scenario, those people might get a fracture from just standing on their own body weight.
Oh, wow.
And so in interventional radiology, a particular fracture that is really common in the United States, a vertebral compression fracture, is one of the complications that people can suffer from this disease. And these vertebral compression fractures is a bone in the spine suddenly compresses under their normal body weight, and it's exquisitely painful, and it can be debilitating, and they can end up in constant pain related to this problem.
And what are some of the treatments when that happens?
Sure. In these people who suffer from fractures and they're in debilitating pain, we do a procedure called vertebral augmentation. And what that is we have the patient lay on a table. We put needles through the back into the bones. And once the needles are positioned within the bones, again, this is not a surgery per se, there's no big incisions, it's a needle into the bone through the back. What we do is we go into the bone that's fractured and make space in the bone and inject a bone cement. And what that bone cement does, it's essentially an acrylic material that's effectively like putting a cast inside the bone. If you think about somebody who fractures a wrist or fractures a leg, you put a cast on it and it feels better. The pain is decreased. You can't obviously cast the spine. So what we do is we put this material in the bone and the bone is stabilized by this material, and the pain is significantly reduced. Additionally, these fractures tend to lose height progressively over time, and the cement stabilizes the fracture from losing further height.
Wow, and the video that we're seeing on the screen really shows that it's basically filling that cavity and stabilizing the whole system. You get the consultation, figure out exactly what the plan is going forward, but it's really about those consequences. If we keep putting this off and don't get this treatment done, what are some of the consequences that we could inevitably end up reaching?
So the people who have this type of fracture usually can point to the exact moment that it happened. They say, I turned in my car, or I slipped on the ice, and boom, suddenly my life was changed. And a lot of times those people will seek treatment right away, either in the emergency room or something like that. But every now and then these fractures are painful, but not painful enough that people initially seek consultation. And what can happen is, like I said, these fractures can lose height over time. And so people can end up progressively bending over, or becoming kyphotic is the medical terminology to it. And the mechanics of their spine can be forever changed. They can end up with chronic back pain. They can end up with issues with breathing and general muscle wasting that really removes their ability to live the life that they did prior to the fracture. So it is really important that people get evaluated for this, particularly if they're in really severe pain after experiencing a problem like this.
Well, I know you're helping a lot of people out. Thank you so much for all the detailed information. I'm sure you're going to get a lot of calls.
Yeah, my pleasure.
We'll get back to enjoying your Colorado life. The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. If you feel like you are suffering from any of the symptoms related to osteoporosis or osteopenia, give RIA Endovascular a call today, 720-493-3406, to learn your treatment options. You can also learn more at riaendovascular.com.